Thanks for joining us for this tutorial, and it's focusing on assignment 6, or if you're not doing the course but you just want to implement the manual, then it's a really important aspect of the work in terms of legal compliance. And this is all about doing the health and safety risk assessment and coming up with a health and safety risk mitigation plan. So this is something that's required by law in terms of the Occupational Health and Safety Act. And it's important not just for legal compliance, but for the health and safety of the people who work in the collections, who visit the collections, and contractors who come there to do something not related to the collections. So it really is a very critical part of work. And so I'm just going to share my screen. Right. So this assignment, and it is something that every institution should have, and I think a lot of institutions do have it, but I think that it often doesn't consider enough the collections. So it's very broad, and there are risks that are associated specifically with the collections. So if it's not done in terms of the collections, there can be major gaps that can put people at risk. So this assignment is to do the health and safety risk assessment for the collections that you work with. And here it's really about the risks to people, not risks to the collections, which were covered in previous assignments or sections. So if you just think about the risks that we've covered in the previous sections where we looked at risks to the collections, some of them will also affect people and not just the collections. So things like fire risks, and then you think about all the types of toxins and exposure and objects falling and other risks. So this assignment is thinking about all the risks in those collections. Once you've identified the risks, then the assignment requires that you develop a mitigation plan. So what steps should be taken to address these health and safety risks? And there you have to think of all the possible options and then identify those that are feasible. So they're reasonable, you could do them. And there is a template, and we'll look at that in a minute. As a reminder, so there's health and there's safety. They're two different things. Health is your kind of your, whether you're suffering from illness or pain or injury. So these affect a person's health and often take a while to result in illness. So they might not always be easy to see or to define or to link to cause and effect. So it's your health. Your safety is a different thing. It's a state of being safe. So how safe are you where you are? So it's, if you safe, it's a condition where you're protected against physical, social, emotional consequences of failure or any undesirable events. So if there's hazards, if there's safety hazards, then it means that there's it's unsafe or it's risky, and it can bring about an immediate effect, an accident. So health is usually slower. Safety is where there's accidents. If you're not safe, there can be accidents. So it's much easier to identify safety risks and to have very clear guidelines to manage them. Whereas health, everybody would react differently to things like chemicals. And people will have different abilities in dealing with this. So it's not as easy. So the first step of this assignment is to identify all the health and safety risks, and we did go through them in the webinar. And what are the main risks? Fire, obviously. So we work with flammable liquids. Ethanol is a classic example, but there's a lot of other chemicals and materials that cause fire. So these are safety risks. So if you have a fire, it's going to be immediate. You can get burnt. And it might not be something that starts with an electrical fault. It can be an explosion that happens because of a buildup of ethanol vapors in a storeroom where you're working with them. But there are things like electrical faults or bushfires, and of course, where you have these highly flammable substances, there's a greater risk of explosion. Also a risk to safety, breaking of bottles, containers, and so then you can cut yourself. Slipping and falling on floors might be created by slippery surfaces or liquid spills. Falling from ladders when accessing high shelving, or whatever way you might use to access high shelving. You might use a chair to stand on, or a table, or a chair on top of a table. So accessing high things can cause falls. You can have injury from collapsing structures or heavy collection objects falling. So if you have very big, heavy fossils that are on high shelves and you try and take it down, it can fall on top of you. Even just moving heavy structure, heavy items. You might have shelving that can fall. You can have injury from lifting and moving heavy objects. So you can do yourself a real injury by trying to pick up something that's too heavy and move it. And then armed robbery and violent crime can also result in injury. So these are all things that are immediate safety risks. What are the main health risks from the collections? Well, toxins used for pest control, so quite a lot of dry collections like herbaria and bones and insect collections have regular fumigation, and those pesticides that are used can be toxic, whether it's through inhaling them or surface residue that gets in through your skin or gets onto your fingers, and when you're eating, you can ingest it in that way. Toxic preservatives, so things like formalin are very toxic, and even ethanol can be toxic. And then working in storage or preparation areas where there might be large amounts of dust or damp or mold or vapor buildup. So often these collection storerooms don't have good ventilation, and you can every day, if you're working there for extended periods, you can be breathing in or touching things that can affect your health. And then the last one here is exposure to disease from animals. So if you work in a collection where there are animals, especially vertebrates, so there can be parasites on them, there can be bacteria and viruses that can be transmitted to people. So even if the animal is dead and somebody brings it in, it can have in its blood or on its fur, it can have viruses or bacteria that can be transmitted to people. So the chemicals associated with collections, ethanol, propanol, formalin, and sulfuric acid are probably the most common, but there's also things like arsenic. So a lot of the old skins were preserved with arsenic, treated with arsenic to keep pests away from collection objects. DDT used to be used a lot for pest control. Methyl bromide was used up until a few years ago. I know it was commonly used in the herbaria. Some of them still use it. Mercuric chloride and naphthalene, which are mothballs. And that's, I think there's still naphthalene mothballs being used. It's a carcinogen. And then for collecting insects, ethyl acetate, you put it in a killing jar and all right. Okay, so we were looking at the chemicals associated with collection. So you need to think about, do we have any of these chemicals in our collection, either in a cupboard or where we preserve specimens or somewhere else? Are there any chemicals? So not only these, there's a long list. And you can check which ones of them can be toxic. And there is a guideline in the manual. All the chemicals are listed there with their potential health impacts. And don't think about just drinking it or just ingesting it. Think about also inhaling. That's where a lot of the risk comes from, breathing in vapors. You can ingest it if you touch surfaces where that chemical has penetrated. You can get it onto your hands, and then you can, if you eat your lunch and you haven't washed your hands, you can get traces of it into your system. And then also absorption through the skin. But usually inhalation is the most common route. Some of these chemicals are carcinogens, so they cause cancer. Others can burn eyes or skin if you get it in your eyes or on your skin. Some can cause nervous damage. Some can damage internal organs. So check the manual. It does provide guidelines. So once you've identified all the risks, then you have to do the risk mitigation. So you have to think about, what do we do about these risks? Often you can't remove them. If you're working in a collection environment, you're going to be exposed. But the law prescribes that every institution must, you've got to take steps to mitigate and manage the risks. You also have to make it very clear what's expected of all the employees for health and safety, for themselves and for others in their workplace. So there are lots of things you can do. Fire and the risk to the staff of having a big fire in the building, it's massive. So you can make sure that you have the right equipment, and that can be your fire detection, your fire suppression, systems to monitor vapors of ethanol and other flammable chemicals. And you should make sure that the suppression system should not harm people and should be the correct type for the type of collection. So if you use these gas suppression systems, those are a risk to people's health or safety. So they extract all the oxygen out of the air. And so if you stay in the room when those things go off and you don't leave the room, you can die from that. So you also have to understand the potential risks of your fire suppression systems. Your firefighting equipment, so fire extinguishers and hoses, mitigation, and then protecting staff for having things like fire doors, keeping the offices away from high-risk storage areas, keeping your flammable chemicals in separate chemical storerooms. So that's having the right equipment, but there's also obviously all the procedures, having an emergency response plan with your evacuation routes, details of the medical emergency services, having all your systems inspected by fire experts, having your systems, your fire detection and suppression systems checked and regularly maintained, and then making sure that your exit routes in your evacuation plan, your exit routes must be kept clear of clutter and obstacles. You must have your fire team who are trained, and you must carry out fire drills regularly. So those are all ways that you can mitigate the risk to the people. So we're not talking about the collections, we're talking about the people. And for your assignment, you can think about which ones do you have already, which ones should you have that you don't have, but which ones would be reasonable for you to have. And then for toxins, what can you do about these toxins that you work with every day? So there should be a list of all the chemicals that are used or present in the collections, and which ones are considered to be hazardous. You should have a list for all your storerooms and know what's in all the storerooms, and then you should have all those material safety data sheets from the suppliers, and it should be kept in a file. And that if somebody does accidentally swallow some of that or get it in their eyes, you can immediately go and check what to do about it. And then you need to know whether staff are being exposed to or absorbing hazardous chemicals, and at what levels and through what route. Are they getting it through the air? Are they getting it through surfaces? Are they getting it through the collection objects themselves? So that's a big thing to understand if staff are being exposed to certain chemicals and how they're being exposed. And so you need to do that assessment of potential exposure to hazardous chemicals at least every 2 years. So you do air monitoring, you monitor the air, you can have an inspection of surfaces by a professional company, and you have to do medical surveillance. Other things you can do is to limit the amount of these hazardous chemicals that's being used. So either replace them with something else that's less hazardous, or you can say you can only work in that area for a certain amount of time, or you can say we're not going to expose all our staff, only 1 or 2 who have no other health risks. We're going to let them be the only ones who do that work. Then also other mitigation, staff must be aware of the chemicals and the potential impacts. And that can be training and signage and labeling everything well. You can also use PPEs, gloves, gas masks, visors, aprons, shoes. There's lots of different things that people can wear to protect themselves. And then also things like storage, how it's stored, where it's stored, what the ventilation is. So you need to have a certain amount of airflow where there could be toxic chemicals. And then the issue of the hazardous biological materials. So this is something that's become very big with coronavirus. It's from animal tissue. Look what the impacts have been. It may have originated from a biobank, a lab. We don't know for certain, but it could well have. And so there is a big risk. And so if you have any samples of blood, tissue, or whole dead animals that come in, you have to have protective clothing, respiratory protective equipment. You have to have all your safe working procedures regarding the use, the handling, the storage, the labeling, how you dispose of any waste materials, whether it's tissue that you've used to wipe surfaces clean, or bits of animal tissue that you want to dispose of. So that's a really critical aspect of work if you have this kind of collection. And then preventing physical injuries to staff in the collections. I think this happens quite often. How do you access high shelves? You know, if you've got a ladder, I know there can be many different kinds of ladders, from rickety old wooden ones that have been in the collection storeroom forever, to very, very good, sturdy, safe ladders. And, you know, if you've got shelving with specimen boxes or specimens or jars, are they attached to the wall and the floor? And how do you make sure that those bottles don't fall off, those objects fall off? So that is a big risk. And then, you know, we're always short of space, and so the tendency is to pile things up. But that's also a risk, dropping heavy things on yourself. So those are mitigation for specific risks, but more generally, you can also include for mitigation, you must have your procedures for emergencies with all your telephone numbers and who the first aiders are, who the ambulance is. And then you must have first aid kits in all the different sections that must be indicated by a sign. They must have information about who to contact if somebody has a bad cut or wound or is hurt in some way. And then You should also have an emergency station where you can wash eyes. And everyone should know how to use those emergency stations. Sometimes you might need those emergency showers. So if you've got some kind of chemical on your body, you might have to have an emergency shower. And then you should have trained first aiders, and they should know how to deal with the different chemicals or hazardous materials in collection. So those, and then these are also general that you can put in for mitigation. So keeping workspaces clear of materials and tools that are not being used. It must be very clean. It must be very well organized. Everything in its right place. All floors, walkways, stairs, passageways, gangways must be in a very good state of repair. So no loose tiles or wooden planks. No broken railings that you have to hold onto. It must be skid-free, free of obstruction, waste material. So I know that things accumulate in these spaces, but it's a very big hazard. I haven't gone into a lot of detail about field work, and I'm not sure whether this assignment should deal with field work, just because there are so many hazards, depending on where you're going and what you're doing in the field. And so I think for this assignment, it's better to focus on being inside the collections, but to be aware that you would also need to cover all of this if you're doing a proper risk assessment and mitigation plan. But I haven't dealt with it here. I just think there's too many different aspects, and it's not always necessarily related to the collections, because you get into a whole research risks. Okay, so I'm going to stop sharing that. I don't know if there's any questions at this stage. I'm going to show you the tutorial. I think that's okay. So this, you've got to do the risk assessment, and you've got to do the mitigation plan, and you've got to select the best mitigation options. And what we did was we developed a template so that you've got some structure and it's not just randomly picking. So this is a systematic approach, again, not just write down any old things. So the first step is to identify the hazards. And we suggest that you use the table that's provided as a template. If your organization already uses a different template, you can use that. And then once you've identified the hazards, you assess them. So how likely are they to happen? And what would the consequences be to the health and safety of the staff? And so that's, again, it's a matter of prioritizing. You're not going to put in place a whole lot of measures to address something that's very unlikely to happen. And if it did, it would have no consequence. So it's really important to think about how likely is this to happen and what would the impacts be on health and safety. So the hazards, in the template includes the main ones, but there may be others that we haven't included. You can add them. And then you've got to say what the details are. So not just say fire, but what's the source of that fire? Where, and then the location, where would this happen? It might be just in the collection storeroom. It might be in the whole building. It might be just in the chemical store. So those are your first things that you need to include in the identification of the risks. So fire, I made up a fake collection that I've used before, my millipede collection. It's stored in ethanol in bottles, and I'm in an old building. There's lots of potential for electrical faults. So fire could happen, and ethanol explosion caused by electrical spark when I put the light switch on, because the light is inside the storeroom. And we have people who smoke in the building, and they may come in there, especially the workers who don't know about the ethanol. So that fire would impact on all the offices, the laboratories, the collection room, and the chemical store. So these are all places that are at risk. And who would be affected? All the staff and all the visitors. It would be about 60 people in the whole building would be affected. And so you go through like a preservative chemicals for the collection. I've said ethanol, we use ethanol. And when you're preparing specimens and bottling them, there's a lot of ethanol fumes. You can inhale it. Sometimes you might have bottles of ethanol or beakers standing there. It's not labeled. Someone may pick it up and drink it. Sometimes people steal ethanol to drink. And I've put here that it's, if you ingest it, if you drink it, it can cause coma and death. So it's not a trivial, and inhalation can cause dizziness, loss of balance. It's like being super drunk in a very quick time. And where is this risk? In the collection storeroom, it's in the chemical store, and it's in our prep lab where we process all the incoming specimens. And who would be affected? The curator. And I said, I'm the curator, and I've got 2 technicians. If we have visiting researchers using the collections, they're going to be opening the bottles, taking things out, and they're going to be exposed. And there's about 12 visitors a year. We also have some specimens that are in formalin, and formalin is highly toxic, systemic poison absorbed by inhalation. The vapor is a severe respiratory tract and skin irritant, may cause dizziness or suffocation, and contact with it can cause severe burns to your eyes and skin. So we have some of that. It's not a lot, but a few bottles. In our prep lab, when we opening, we may be rebottling, changing the preservative in our collection storeroom, and of course the same people are exposed. Fumigation, you might not fumigate your collection, but you might have regular building fumigation by a service provider. They come in, they spray everywhere. You have to think about what chemical they use. You might have ethyl acetate that's used for killing jars, and it's a highly flammable, toxic. When you ingest it or inhale it, can do big damage. And that would only be when you're doing field work or in the prep lab or in the chemical store. You might have cyanide. I remember when I worked in a collection, there was a bottle of cyanide in the cupboard. It was an old bottle, one with a glass stopper. And they used to use it in killing jars, and it sat there, and I sniffed it just to see what it smelled like. So it might be something that's not opened regularly, but it's you just don't know. You're got to think about hazardous biological materials. So for my millipedes, they don't really transmit anything, but when they're live, they do secrete chemicals. One of them can be cyanide. It's like a chemical compound that can burn your skin. So that's where would that happen? During field work or in the prep lab? People bring in live material. Exposure to dust or mold, where would that happen? In your damp, dark collection storeroom or your chemical store. Falling off ladder. So what I said is that we've got specimens on very high shelves, and we use a wooden old rickety ladder to access them, 3 meters high. So I won't go through all of them, but you can see this is the kind of thing that you need to do. You need to go through all of these potential risks and think about, is it relevant? Is it not? What are the details of that risk, where is it, and who would be exposed. Then once you've done that for everything, you look at assessing those risks, not just identifying them, but now assessing them. So how likely is it to happen? Is it rare, unlikely, possible, likely, or almost certain? And how severe would the impact be on the health and safety of the people in the collection area? So if it happens, how severe would it be? And it can be insignificant. So if you, if you're exposed to the chemical that they're fumigating the whole building with, it might be insignificant. Minor, you might need first aid for something, plaster, dressing. Moderate, you have to go to the doctor. Major, you have to go to hospital. And critical is death. It can be, it's fatal, or there's permanent, you have a permanent disability as a result of it. And there can be more than one person affected. So I'll show you those tables in a minute. They are there on the templates. So for fire, I've said it's possible. And possible, let's just go and look at what those things are. Yeah, so there's the categories and what they mean. So the likelihood, if it's possible, it may occur within the foreseeable future. So it's possible that we'll have a fire. We have old building, poor electrics, and highly flammable ethanol collections. So it's possible. Unlikely, so it's not likely to occur in the foreseeable future. Rare, only in exceptional circumstances. So fire could be rare if you really have very good fire detection, suppression, all of, no trees or vegetation around your building, all the regular inspections are in place. You have very good ventilation and extraction systems. Then it would be a very exceptional circumstance. But if you consider how many buildings have burnt, public spaces have burnt in the last year or 2 years or 3 years, there's a possibility that unless you have all of that, it's going to happen. And then likely to occur within the foreseeable future, and almost certain to occur within the foreseeable future. So fumigation of your building is something that is going to happen. It's almost certain to happen that they are going to come and fumigate. But then you look at the consequence or the impacts. So it can be insignificant, no treatment required, minor, moderate, major, critical. All right, so now you have to go back to your whole table with all the risks you've identified, like fire. I've said it's possible. And here it was quite difficult to know what the impact would be, because obviously it depends on how severe the fire is and whether it's controlled or not. But if you have a fire in the building, I've said it's going to be major to critical. Once that fire is going and there are people in that building, that's probable. Preservative chemicals for the collection, ethanol, it's likely. So people are very likely to be exposed. This could even be almost certain. Almost certain people are going to be exposed. Oh, sorry about that again. I've switched to a different system now, and I hope that it'll be a bit more stable. Okay, so you're going to go through all the risks that you've identified, and you're going to think about, is it, how likely is this to happen and what would the impacts be? And then once you've done that for everything, then you're going to use this table to categorize them as low risk, medium, high, or extreme. So if something's almost certain to happen, like our fumigation, but it's insignificant, it still comes out as a medium risk. It's almost certain to happen, and it's going to have a moderate impacts. So it will cause people to have to go to the doctor. Categorization. So I also struggled sometimes where I'd put in that the impact would be moderate to major, or it might be minor to major even. Then what do? And that's where you really just have to make a judgment call. So go for the middle or go for the more up rated rather than down rated. But you'll see, I also did, I did have like a range. So my fire came out as a high, could come out as an extreme. And then the ethanol exposure came out as, and I put it as medium to high. It's difficult to know because I had minor to moderate in the impact. But you could just go with the high. And some of them I put medium to high, and that's fine. You can do that. High, extreme. So this is my wooden ladder that I'm climbing up to access my top shelves. It's likely to happen. I could have a small fall, or I could be very severely injured and have a permanent disability because of my injury. So it's a high to extreme. So I don't have any low in mind, actually. All right, so once you've done that, then you're going to look at your mitigation. So you just need to do this for the highest risks. I did say medium, high, and extreme. If you've got lots of high and extreme, like I had lots of high, you can just do it for high and extreme. So what steps should be taken to mitigate these health and safety risks? You can think of all the possibilities first. And I don't know if you remember when we had the discussion forum, SIAB showed us their framework, and it's a very useful framework to use. So this is the hierarchy of mitigation, of controls. So can you eliminate that risk completely? If you can't, can you substitute it? So can you rather use something else instead of what the risk is? Can you put in place engineering controls? And so that would be equipment. Can you put in place administrative controls, which are policies, procedures, standards, or do you need PPE, so personal protective equipment? So those are the things to think about when you're doing mitigation. And there's a table here that you can use for the assignment or for your proper plan. And so you list your hazards in order from extreme to high or medium if you're going that low. So ours is fire. Can you remove the hazard completely? You can't really. You will always have a fire hazard. It might be low risk. You can't substitute things. You can't get rid of it by substituting. So it's not going to be eligible here. But you can put in place engineering controls, your detection system, your gas suppression, your fire doors. Those are all engineering controls that you put in place. Extractor fans for your ethanol buildup, monitoring systems to monitor ethanol levels. And then under your administrative controls, you might say we're going to have monthly checks on functioning of our detection and suppression systems. That's a policy, procedure. We're going to have evacuation drills monthly. That's a procedure. We're going to have procedures for ethanol monitoring systems and response limits. So those are all your administrative, those are paper things. You can't really wear PPE. It's not, I mean, you're not going to go to work in a fire suit every day. And then for your preservative chemicals, your ethanol. So you can't remove it. You can't eliminate it completely. It's probably the safest chemical that you can use as a preservative, so you can't replace it with something else. You can install a whole lot of different things, extraction fans, monitoring systems. So you can see those address both fire and chemicals. Then you can bring in your testing. So you're going to have annual testing for the staff in the collection. They're going to go for their medical checkup. You're going to have signage for all the areas where ethanol is used and stored, warning people about it. You're going to train everybody, and everything must be clearly labeled. So there's a whole lot of things that you can put in place. You can have PPEs for ethanol. Some people might say you must use gloves. I know at SIBE they use those big, scary, like spacesuit things, hoods that have a filter, but it might not be. You could put that in. For your physical injury falling from a ladder, so you can say we're not going to use ladders. You can eliminate that risk by saying we won't. We will have shelves that are only chest height, and so you'll never have to get up a ladder. Or you could say that the ladder that we use must meet health and safety standards. Or you could use scaffolding type walkway for the upper shelf. So you could construct something so you're not having to stand on a ladder. You can have your training under your administrative. There's a whole lot of different things that you can do. And so you go through all your top risks and you think about all the possible mitigation under each of these control categories. And then the last step is to look at the feasibility. So which ones have you done already? So they may be done already, and I flagged them in green. Which ones should we do? We can implement them. They're reasonable, they're feasible. It might cost some money, but it needs to be done. You can flag those in a different color, and then ones that would be great, but they're not going to ever work. You know, building, scaffolding, walkways might just not be reasonable. It might not be feasible. So yeah, so you can go through and you can flag them in different colors or however you want to, you know, say which ones you think should be done and which ones can't be done and which ones are already in place. So, you know, things like putting in extraction fans, it's actually a legal requirement. It's almost like you have to do it. You don't have a choice. And then things on paper are easy to do and to make sure that they're implemented. So doing your monthly checks, doing your evacuation drills, having your procedures for ethanol monitoring systems and your response limits. So those are all your paperwork things that you can do. All right, so it's quite a big assignment to do, because the first thing is to go through every possible thing. I think you can, if you're in a big institution, confine it to the collections where you work and think about everything in the area where you work. Don't worry about the entire building or all the collections if you're not, if you don't work with them. So focus on what you can do for this assignment. Obviously, if you're doing this for real, you have to consider all the collection areas. Okay, so it's a big assignment. It could take quite a lot of time. Again, there's not going to be one right answer. Everybody's going to have different answers depending on your collection, your institution, and solutions that you might think of that other people don't think about. Okay, any questions? I've been rushing a little bit. I'm worried that I'm going to be dropped again from the internet, but are there any comments or questions or things that people have struggled with if you've started doing this? Has anyone done it? Andrea, have you done it?
Michelle, no, this is the only one I haven't done. But can I just wanted to ask, I'm not sure, there where you've got that colourful table with the risk assessment, do we do a table like that for each one? Or is it a general table?
So let me just go back to it. So this is the table that you'll do for, yeah, you essentially have one table with all your risks identified. All your risks will be there, and then then these, this one, is this one you're talking about?
That one, yes, with the colors, with the extremes. So once we've identified which ones are extreme or high, how do we then complete this specific table?
No, so this is a table that you just use to categorize.
Oh, okay. All right, got it. Thanks.
So you're going to go through. So I actually, when I was doing it, I was doing this exercise, and then it was really difficult to have to keep going down the document to look. And so I actually I printed it out on a sheet of paper.
Okay.
And as I worked through my table at the top, I could just look at this category table and look at the likelihood and the consequence and get my sort of rating.
So thank you for this. The table that you did really, really helps as an example. Yeah.
Okay, so maybe we must put this on the website. So it's not 100% complete. It's really just to give you some example of what kinds of things are needed in the different sections.
Thanks.
So then you're going to have your table as well for the mitigation.
Okay.
And you're going to list the high and extreme risks down that side. You don't have to do it for everything. Okay.
Thanks.
All right. So people happy, confident, you know what you need to do. A very important exercise to do. All right. So if there's nothing else, so nobody else has started this assignment yet. It is the most recent one, so yeah, okay. All right, so we'll leave it at that. I'll send Fulu this example that I've done, and I'm just worried that people get confused if they weren't here. I don't know. Did it help you just seeing it?
Yes, absolutely, Michelle. I was taking notes of your examples, so yes, I think it would help everybody.
Okay, we'll just make it clear that it's just an example only, and that it's not, everyone will come up with different material. Rendani's done it. Rendani, first one out of everybody to do the assignment. I think maybe some of the others who are not yet did it and they found it easy. You wrote numbers instead of the words. Okay, all right. So, so you scored it like a 1, 2, 3, or 4, 5 for likelihood and for impact, and then 1, 2, 3, 4, 5 for whether it's low, medium, high, extreme. Yeah, okay, all right. So you can do that. It might just be easier to know to write in there what it actually stands for, just for making interpreting the tables easier. I think it's easier to write the whole word there. But good, well done. Okay, so if everyone is happy with what to do and ready to go and get it done, that's great. And this is the last in the series of tutorials. We'll send out a reminder to everybody to get their first draft of all the assignments that they're going to be doing in by the end of the month, which is not far off. All right, and remember that that can just be a draft. It doesn't have to be 100% complete. All right, thanks everybody, and we'll see you in March for when we get back to the webinars and discussion forums. Next month we're dealing with the data management chapter. Okay, thanks everyone. Bye. Have a good afternoon.